Hello, everyone, and welcome to my presentation. Thank you all for being here today. And I will be doing my presentation on concussions, their symptoms, and why they matter. And so sports can be dangerous. Accidents can happen and people can get injured. Few things in life are more guaranteed than the fact that injuries and accidents will happen. And few injuries are more damaging or dangerous than concussions, particularly in the long term and for the long-term well-being of a person. Whether you're an athlete yourself, have a relative who is an athlete, or just work in a field that can have head injuries, being able to identify and effectively treat a concussion can be essential to the health of the concussed person and their long-term well-being. This topic is important to me, both as an athlete and a coach. I have had a concussion myself, and I've had several friends who have had concussions, and actually recently had to deal with a potential concussion on the field. And so a concussion can be caused by a bump, blow, or jolt to either the head or body that causes the brain to move back and forth rapidly, as per the CDC. And here we have a diagram by Bronson University showing an example of that with an impact to the head and the back and forth motion of the brain inside of the skull, as shown by the blue arrows, that can cause the compression and damage of the brain. And the most important step to treating a concussion is identifying that it may have occurred. Once that is done, identifying if the person has symptoms of concussion is important for determining if additional treatment is needed and if care needs to be taken, especially if the person's had a concussion before, because that can make the damage worse. And the most important step to treating a concussion is recognizing the situations that can cause a concussion. Knowledge of the causes of a concussion are essential in identifying possible concussions and ensuring the safety of the injured person. The severity of the impact can vary and can seem minimal at the time, but can still result in a concussion. And so being aware of that and being cognizant of the fact that that can happen to anyone is essential to the safety of yourself and those around you. Recognizing the symptoms of a concussion is essential in the process of identifying and treating concussions. And the symptoms, as per the University of Utah, are the loss of balance or dizziness. Concussions may cause a headache, temporary loss of consciousness, feeling as if your brain is in a fog, delayed response to questions, dizziness, ringing in your ears, nausea and vomiting, fatigue, blurred vision, and sensitivity to light and sound. And these are only the most generic of the symptoms that they were able to specify. They did specify that there were additional possible symptoms, but there were too many to list. And so looking for these symptoms is the first step to identifying if a concussion has occurred, but there may be others that do not match this list that you should also be aware of. Knowing these symptoms is important so one can quickly identify if a concussion has happened and take appropriate actions. And seeing these symptoms mean that a concussion most likely has occurred and the concussed person should be taken to a doctor for tests and possible imaging. And the danger of concussions is not only in their immediate damage. According to Harvard University, chronic traumatic encephalopathy, also known as CTE, is thought to be caused by repetitive brain trauma, including repetitive concussions and even repetitive subconcussive blows to the head, which means that not even blows that would normally cause concussion are needed in order to cause long-term CTE if repeated impacts are applied to the head. However, they can be made worse by the presence of previous concussions and are amplified as each concussion occurs and are stacked on top of each other. And here we have a diagram of chronic traumatic encephalopathy, where we see a diagram of a brain deteriorating as it takes repeated impact to the head, where on the far left, you see a regularly healthy brain, and on the far right, you see a brain with severe CTE. And as you can see, the brain deteriorates significantly. It begins to shrivel and develops holes in it due to the damage caused by the shifting within the skull. The shifting in the skull causes compressions that leads to the development of tau scar tissue, which is not the same as brain material and can lead to rips and tears that are further or accelerated by repeated concussions. And CTE can lead to a variety of problems and has a number of symptoms, with the most generic being problems with thinking and cognition involving difficulties with learning, memory, the ability to connect experiences, memories, and behaviors. Mood changes often involve problems with depression, irritability, loss of motivation, and suicidal thinking or behavior. And behavioral changes are typically seen as problems with impulse control or problems with substance abuse. And generally, all types of CTE issues stem from those three, with problems with thinking and cognition, mood changes, and behavioral changes, as per Harvard University. And although concussions can lead to horrible side effects, safety and knowledge can help prevent and treat them, allowing you to mitigate risks to injured people before concussions and after they've happened. Concussions can be caused by impacts to the head and can lead to identifiable symptoms immediately and lead to longer-term symptoms if the concussed person is not treated or if the person is concussed repeatedly. Concussions can be devastating and permanently life-altering if left untreated and not properly recognized, but being informed about the causes, symptoms, and effects of concussions can allow you to prevent that from happening. And then here we see all of my sources, and then here are my sources for my images. Thank you all for being here today.